Alrighty.
Slide is visible?
Yes, we see the slide.
Okay.
So last lecture. Is that crazy? Let's get it started. So hi everyone. We're happy to present on our analysis of the Just Wash Your Hands program today. Our consulting team consists of members of various backgrounds, and we have been hired by the London Health Sciences Centre to investigate why their hygiene project called Just Wash Your Hands has not delivered expected results. Today's presentation will look into the background and significance of hand hygiene in healthcare settings, as well as the proper steps of conformance for hand washing procedures, referred to as the 4 moments of care. After this, we are happy to conduct a live interview with some exciting guests and learn from their very own experiences, followed by a recommendation on how to move forward with the program. Finally, we hope to create an engaging discussion roundtable with a question and answer session, and please everyone have your smartphones ready for that. Before we dive into the depths of the analysis, next slide please. Before we dive into the depth of the analysis of the case, we would like to provide you with some background information that highlights the importance of proper hand hygiene in healthcare settings. In 1840, around 25% of women in Europe succumbed to the effects of the so-called childbed fever. Dr. Semmelweis, an Austrian doctor, saw a clear connection between 2 groups that were responsible for child delivery. While delivery with midwives had a regular mortality rate, mortality when delivered with the help of medical students was about 3 times higher. Dr. Semmelweis has made the connection and ordered the medical students to wash their hands after returning from the autopsy room. After washing their hands with the chlorinated solutions, this small change in procedure led to a mortality rate of less than 1%. He's still referred to today as an early pioneer of antiseptic treatments. Fast forward to the year 2007. Healthcare-associated infections still remain high, and about 250,000 admitted patients in Canada per year get infected during their hospital stay. This results in about 8,000 deaths, which is still about 0.4% of all admitted patients. Compared to the mortality rate of less than 1% in the 1800s, that's not really considered a huge improvement. On top of that, antibiotic-resistant organisms also cost more than $50 million per year and are a serious threat to the healthcare institutions. And now I pass to Binwen to get us a bit of an analysis of the program.
Thank you, Toby. So now I'm going to talk about when is the time to clean your hands. Healthcare experts have determined that there were 4 situations when hospital staff needed to clean their hands, referred to as the 4 moments of care. These moments were: Moment 1, before initial contact with the patient or with the patient's environment, including furniture, clothing, medical device, telephones, and any personal items. This step was to protect the patient from harmful microorganisms carried on a staff member's hand. Moment 2, before aseptic procedures. This step helped prevent germs that were on the healthcare worker or on the patient from entering the patient's body. Moment 3, after body fluid exposure risk. This step included glove removal and ensured that the medical staff member was protected against harmful bacteria and virus. Moment 4, after contact with the patient or with the patient's environment. After the Just Clean Your Hands program, hand washing rate had been greatly improved. We collected compliance rates of moments 1 and 4 for University Hospital and Victoria Hospital. We can see that they were both on a rising trend. Victoria Hospital increased a lot faster. Ideally, they want to reach 100% compliance rate, but they don't know how to improve that. Now I will hand over to Vinod for a live interview.
Thank you, Binwen. There are many key elements in health settings, and we would like to ask them directly. During our investigation, we decided to ask from key players. This will give us a clear picture about health hygiene issues. So we have invited a physician, a nurse, a visitor, and a union worker. So let's start with our physician, Dr. Santella.
Good morning. Thank you so much for the invitation. Let me introduce myself. My name is Dr. Paulina Santella, and I am part of the group of surgeons of this hospital.
Okay, Dr. Santella, are you aware of the importance of washing hands?
Of course, I'm aware of the importance of washing hands, but let me tell you something. First of all, I keep up to date with the CDC guidelines in regards that hand washing is the single most important means of preventing the spread of infection, especially health-associated infection. And of course, I'm also aware of the importance of hand washing. I learned it in medicine school. Who doesn't know about Dr. Samuel Weiss, father of hand hygiene?
Okay, if you are aware, why don't you comply with it?
I wouldn't say I don't comply with it. It is more complex. Let me explain you. First of all, my workload is huge. And based on that, I can find the time to look for a convenient sink to wash my hands. And additional, I hate going inside patient restroom to wash my hands. Very important, last but not least, physicians are not employees of the hospital. We charge a fee for services to the Ontario Health Insurance Plan.
Okay, thank you for your time, Dr. Santella. Next one is the nurse, Miss Florence.
Hi, I'm Florence. I'm a nurse come from the University Hospital. Thank you for inviting me to the interview.
Okay, Florence, what is the most difficult part for complying with the hand hygiene rules?
Yes, we did want 100% compliance for hand hygiene because it's so important to our patient safety. But it's just impractical because we are very stressful. That's a moment of life and death, and our workload is so heavy. And we did try our best to get 15-second rub washing, but it just sometimes we are really, really very stressful, and then it's just so it's just so difficult for us to get that 15-second. And you know what? Our hands were all cracked with all the frequent washing in the one shift.
Okay, I heard that some of the healthcare workers show concern for banning nail polish and hand accessories. What do you think about that?
Well, me myself don't wear those polish or accessories, but I did see some of the nurses would do so. But after all, it's just their personal choice.
Okay, thank you, Florence. Let's know from a visitor, Mr. Toby, the difficulty who face when he visits the hospital.
Yeah, hi, thanks for having me today.
Are you coming here regularly? And what problem for washing your hands you face upon arrival?
Yeah, I've been coming pretty regularly. My relative was admitted to the LHC last month, and I visit him about 2 times a week. I personally do not see the significance of washing my hands because we're talking about hospital germs. I'm coming from outside, so the chance for me carrying hospital germs is really low. And yeah, I think it's a lot higher for a healthcare professional that actually touches other patients.
Okay, so how do you wash your hands?
I generally still rinse my hands when I get to the room. Usually I just use hot water. I believe that this is more than sufficient. I generally do not like the hospital soap. I don't like the smell. I don't like how my hand feels afterwards. So yeah, I generally just rinse it with water.
Okay, thank you, Toby. At last, let's know the point of view from a union worker, Ms. Binwin.
Hi, good morning, everyone. Thanks for the invite. My name is Binwen. I'm the clerical from the union.
Binwin, do you comply with the hand hygiene rule?
To be honest, I forgot to do it most of the time. I've been working here for a long time. I know my job and I pretty much did the same thing every day. However, recently, some students just came in and watched me to do my job and telling me we're not doing the right thing. It's just so confusing.
Okay, so in your opinion, why most union worker does not comply with the hand hygiene rules?
Well, hand hygiene process is complicated. No one tell me how important it is. We all have long-term contracts. I don't get paid more by washing hands, and I also don't get punishments by not doing it. I just don't know why we need to wash hands so many times a day.
Okay, thanks, Binwin, for your time. So let's move to Paulina for summary of non-compliance.
Thank you. Based on the above, the causes for non-compliance can be summarized as follows. First, in the case of physician, it is behavior, and since they're not employees of the hospital, they're not obligated to follow internal procedures. Second, in the case for the nurses, they have heavy workload and additional there were nail polish and hand accessories. In the case for visitors, they were unaware of proper hand washing procedures. And similar to the support staff, they don't often perceive the risk of infection as minimal relative to inconvenience of hand washing. And last but not least, the union member. They don't have an obligation for hand washing, and imposing disciplines for not hand washing are very difficult. So as you may see, all these persons come from different backgrounds and have different reasons for non-compliance. Therefore, it's really difficult to find a unique reason why don't comply with the project. Now, let's go back with Florence.
Thank you, Paulina. So with all the above non-compliance factors among different subgroups, here's come the question of who should be the leader in this Wash Your Hand program. Should be a single talent expert leader or a shared leadership among the multidisciplinary professions. For the expert leadership, a highly recognized influential authority will win trust from the professionals, especially like physicians in our London Health and Science Centre who take pride in their professions. However, the expert leader has to be real talent, or else the leader is unlikely to win trust from the fellow professionals. Whereas for shared leadership, multidisciplinary coordination could benefit from a wider knowledge base for innovation and problem solving. Each professional leader can be a better representative for their groups. However, it is not done with no cost. It could be time consuming for communication, and there could be leadership competition among the multidisciplinary professions. So there is no easy answer for this question. As you guys have mentioned before, hospital can be quite a hierarchical system. So in our discussion, we would suggest expert leadership in the case of London Health Science Centre, if there is an elite leader who are willing to take up the role. Because for the case of London Health and Science Centre, an elite leader would be effective to win trust among the physicians and unify all the subgroups. So I will pass to Vinod to give us the recommendation.
Thank you, Florence. There have been many approaches to improving hand hygiene compliance in healthcare settings, but the introduction of a multifaceted, multidisciplinary strategy is the most effective. Here is our recommendation, which can be developed and implemented in all healthcare settings as per the need. The most important thing is about leadership, under which senior and middle management support is required to show the urgency, with a commitment to make hand hygiene an organizational priority with formulation of policies and guidelines. They must facilitate adherence to best practices and provide leadership and decision-making to actively engage in the process. Secondly, infrastructure can be improved with environmental changes and system support, including placement of alcohol-based hand rub at the point of care. User input into product selection, which is based on number of factors like efficacy, safety, environmental concern, is also required. Also providing simplified instruction for users of infrastructure. Third in the list is education and training for healthcare providers about when and how to clean their hands. Periodic retraining to reinforce their practices, and staff motivation, visual workplace reminder is also required. Next one is opinion leaders and champions modeling the right behavior in public forum and discussing the hand hygiene practice. By doing that, these champions will promote hand hygiene as a shared responsibility. Another aspect is patient family visitor engagement through education. We have to encourage partnership between patients, their families, and healthcare providers. And last important point is ongoing monitoring in regular basis and observation of hand hygiene practices with feedback of compliance data and improving the process in future. It requires trained auditors, standardized audit tools with clear instructions. Since no two health settings are always same, not everyone works in a nice new hospital. Some work in community, some work in old facilities. Therefore, all of this will help in strengthening your hand hygiene program and make it more localized as per your need. That's all from us in recommendation part. Thank you. These are some references which we have taken for our case study. Now we will move to question and answer round conducted by Toby. So I'm just switching my presentation.
Perfect. So yeah, question and answer session. As I said in the beginning, please have your smartphones ready. Take the camera function and we will share a QR code very shortly here. If you do not have your phone with you, you can also join with a browser. It's a little bit more, you probably have to do a shared screen or something, but we will pull it up right now here. So yeah. So this QR code, just take a picture and go to the internet page, and then you can type in a nickname. We see a couple people already here. That's great. It's a good thing with a very engaging class. We always have a lot of people contributing. So we give this a couple more seconds here. Who's Popo? A couple of funny names here. Awesome. Okay, still some people coming in, but let's go ahead. If you have the picture of the QR code, you can still join during the question and answer session. And you will also see a link here, kahoot.it, where you can join anytime after or during the presentation of the questions with the game pin. Okay, let's move to question number 1. So the way this works is your phone will be your voting device. We have 8 questions in total, and the first question is, you can multi-select. So what are the main reasons for non-compliance and why? So you should now see on your phone the color code. Is it lack of motivation, lack of leadership, lack of communication, too much workload, maybe all? For those who may be colorblind, you can see there's also symbols that you see on your phone. And whoever has not had the chance to join on their phones, you see the link on the bottom here, kahoot.it with the game pin, so you can join while the presentation is going. 47 answers. How many do we have in the chat here? Wow, that's nearly all of us. That's awesome. Okay, don't forget to click submit. There's a submit button. Okay, good. So we have our clear winner here. Too much workload. So please do raise your hand function in Zoom if you would like to contribute. What do you think is the one that you selected here? Maybe the one too much workload. Why is that so? We would like to have some direct feedback here as well. Jordan.
Yeah, I actually picked 3. I picked lack of leadership, lack of motivation, and too much workload. For the lack of leadership perspective, there is a discrepancy between what non-bedside staff do and what bedside staff do. So non-bedside staff have their nails painted, have jewelry on. So it's not been very good role modeling for those who are on the floor. And in terms of workload, a huge contributing factor to my non-compliance with hand hygiene has been a lack of supplies readily available. So we've had our hand sanitizers locked behind 3 different locks to get to. So how do you ensure that staff are compliant would be having better access to hand sanitizer from the get-go?
Yeah, those are awesome points. Thanks for sharing. So lack of access, this is also one important thing. So please feel free to share additional thoughts with us. Shalisa, please.
I wanted to kind of paint a picture for why I think it's basically all of these. So let's say you're in your 2-bedroom and you're taking care of patient A, and patient A, you just set up their food tray for them, okay? And you're just about to go and wash your hands and leave the room when patient B says, oh, can you just grab this from me? And so now you can either wash your hands, take the 15 seconds, or go and get thing from patient B. In the meantime, when you're making that decision, the call bell rings and you need to go do something else. So that's the kind, it's not like a workload, like too much work, but it's like split-second decisions that you need to make before you go and do the next thing. So I think that is I'm trying to paint a picture for somebody who's not in healthcare, because I think that'll make a difference in how you see. It's not necessarily lack of compliance, but just you can't do all the things at the same time. And then I think everything else everybody's already touched on. So
awesome, thanks, Shalisa. Yeah, that's a good thing that we have so many professionals on this call, that we really get to understand what the main things are here, and it's really a combination of all of those. Terence, please.
Yeah, so, well, obviously I'm not a nurse, so I hope I'm not judged too hard for what I say. But I agree with what's been going on in the chat. Like, workload is definitely seems like one of the main factors. But when I was reading through the case, they also said like established behaviors, and in my experience, like established behaviors are just very hard to break, regardless of how important like the end goal is. There's just a lot of resistance, and it's just for many different reasons.
Absolutely, yeah, that's a great point. The established behaviors, that really has to be a kind of a change in thought on how to approach this. Okay, last quick one from Narges, and then we have to move on.
Yeah, I was one of those people who voted for all of them, and I think the lack of communication is one of the most important things. On top of the things that has been highlighted by all of our colleagues, the lack of communication is mutual. It's not only from the leadership to the people who are working, but also the voice of for example, in this case, the voice of the union was not heard enough, and it was not strong enough to be heard or to make a change happen. So that's something as well, on top of all of the things that we have discussed. So I guess all of them all together play a role.
Absolutely. Thanks so much for all these contributions. Let's move to the next question, please.
Thank you. Our next question is an open question, so you need to write down your answer. But think out of the box idea would you explore to improve hand washing? I know that the previous team had a similar question, so I have heard and read some great ideas. For example, that from Helen in regards kids are advertising during TV. Additional, we already heard Shalise and Walter talking about habits. So please keep it simple and short. You just have 20 characters, but if you need more space or would like to share with the entire class, please use your raise your hand function in Zoom. And very important, please don't forget to submit your answer. Okay. We still have some seconds. Okay. So the first one I'm reading is punishment, technology, normal like breath, contamination bugs. Anyone would like to share their opinion? Nargis, would you like to start, or it was from the previous one?
No, it was for the last. Sorry, I just put my hand down.
Thank you. Travis.
Hi, I was typing the normal like breathing. I've heard a lot about the time constraint or the real situation about hand washing related to workload. And I was thinking if we are improving as for the leadership, actually we can make hand washing like normal, like breathing. That's something you have to do it to survive. Yeah, and you guys have reminded me that physicians or visitors or even the administrative workers are part of the hospital. What if the leadership start to engage these group of people which are not front lines, and when these non-frontline workers or parties or stakeholders are motivated, and they will create an atmosphere to further or backward motivate the frontline workers like nurse or other healthcare workers, like just like breathing to make it. Yeah, this is my thought.
I really like the idea of normalizing hand washing. And if you would like to survive, you need to do it. Thank you so much, Travis. Walter.
I think you have to remove the barriers that we have. For example, if you make it more accessible, for example, getting the Shalisa example, I thought it was a good one. For example, if you provide small bottles of hand sanitizer to anyone that gets into the building, some small things, maybe you can just use that because she had a tough decision, small time. Maybe a hand sanitizer in her hand, just grabbing into her jacket can be used and reduce, you'll not fulfill the full step of washing your hands, but can reduce the amount of disease spread. So you need to reduce the barriers. That's the point.
I really like it. If you have something in your hand, it will remind you that you need to put it in your hands. Thank you so much, Walter. Singh, Harry, would you like to share with us?
Yes, I think, I don't know, I was reading the report and I found there was like in the US, they installed chip in all the employees in the hospital. I don't know how that works, but I think it's just a constant reminder you need to have, like it should be back of the mind. Okay, I need to wash my hands. But I'm surprised it's not just the nurses. Like I get the nurses have a very busy schedule and work, but the physicians are not doing it as well, which is kind of scary at the same time. Like the negligence becomes pretty big. So I think there should be some way we can get a phone app or something which says a constant reminder or something like, ding, you have to wash your hand. Okay.
I find it great. Every time you move from one bed to another, your phone, your mobile can start making some sounds to remind you that you have to wash your hands. Great idea. What about you, Agatha?
Again, I think Travis had mentioned atmosphere, just normalizing it. And, the focus has been a lot in the conversations with nurses and doctors, but I think it's also housekeepers and food service providers, everyone. And I think a large part of the issue is people are afraid to speak up because, again, there's hierarchical issues, there's politics. You don't want to say to someone, if I'm a social worker to a doctor, hey, did you wash your hands? Like that would not go very well for the most part. So I think it's really looking at the broader picture and looking at the whole system as an issue as to why people might not feel comfortable speaking up. It's just one aspect of it, but I think.
Yes, I can imagine a student telling the physician, you haven't washed your hands, you haven't washed your hands.
Yeah, and it's happened a lot. It's happened before, and it's like, I don't want to say anything. I'm going to get yelled at.
Yes, yes. Thank you so much, Agatha. And last, Shalisa, would you like to share with us?
I think Jordan said in the last one in the chat box, but I just want to bring it up here quickly, is that a lot of this has changed since COVID. There's a lot more policies, like as soon as you enter the hospital about like hand hygiene as visitors, walking into the ICU, you have to wash your hands and change your mask. All these things have changed since COVID. So even though a lot of us are focusing on the nurse and the physicians and the social workers that are in and out of the rooms, a lot of stuff does come in from the outside, and that has changed since COVID. So just want to reorient us to that.
Thank you very much, Shalisa. And we will need to keep going. Bingwen, you're next. Thank you very much.
Yes, so thank you, Paulina. So our next question is a poll question. Could an individualized approach for the different professions be an option to tackle the problem? Is it yes or no? Do you think we should apply different methods to different groups? For example, we treat nurses and doctors in different ways. Do you think that will help improve the compliance rate? Well, please also think about the method you will use to treat different groups. Yeah, we still have 5 seconds. Please put in your answer and submit. Good. All right. Well, look at the answer. Anyone who picked yes want to share their idea? Go ahead, Harry.
I think individual approach would be a bit, I said no for a reason is because I think as a group, if someone is taken out of a group and said, hey, you are not complying with it, and he might get a bit threatened. So I feel like reaching someone with an organizational approach, like a team approach, would be better in this scenario, maybe helping them, and their managers can probably pick who's the naughty kid and deal with him appropriately.
Yeah, I agree. Don't treat everyone equal. It's definitely good. So Walter, you want to share your idea?
Yeah, maybe it's not possible to create individual approach for each person, but by groups and teams, for example, medical and nurses. The point is you need to engage the people, and each group has their own aspiration. So you need to deliver the message right to your public. That is the main thing, one of the main things of leadership. So if you do that, you can get better results, I think.
Good, good. I like that idea. Lindsay, do you want to share your idea?
Yeah, I chose yes, but I was looking at it as individuals being groups of professions. So I was thinking like the primary care providers who aren't employees of the hospital. It's important to kind of tailor your strategy to how they work, what their motivations are, and it's going to be different for the unionized nurses and the unionized cleaning staff, but we all have a part to play. So it comes back to what you guys were talking about, creating that vision. So having that overarching concept that we're all in this together, each of us can make a difference in our own way, but tailoring the message to each of those groups so it applies to them appropriately, because you're going to talk to different jobs differently.
Good, good. I like the idea of tailoring the message to a different group. Nasib, you want to share your idea?
Yeah, sure. Thank you. Actually, this kind of initiative is like this thing is involving many kind of rules and many kind of people. So, like to start with, we can say that okay, for certain groups we give some relaxations, but eventually it will lose the effectiveness. We will not be able to achieve the desired results over the period of the time. So as stated in earlier comments also, like it should be overarching. So in staged manner, if you want to adopt it, I would say yes, or otherwise overall my preference would be like I don't want to exclude any group from this kind of initiatives.
Good, good. Thank you. Thank you for sharing. So for time missions, we have to move to next questions. Thank you for engaging.
So the next question is, what strategy would you use to improve motivation among staff about the importance of proper hand washing? So please type in your answer and keep your answer short within like 20 characters so that we can see everybody answer on the screen. So you may want to think of ways, maybe positive motivation or negative motivations to get people wash their hands. And we just have discussion on the floor that motivation in short run or intrinsic motivation in the long run will be applicable too. So you may want to think about these factors when you think of the motivation. So let's see, a lot of answer. Pizza buddy, yeah. So anyone have thoughts want to share? Coaching style, yeah. Helen, please go ahead.
I think one of an important way to improve motivation would be having regular evaluation or ongoing monitoring. Once you have something implemented, we need to evaluate how good or how bad we're doing. And if they see, for example, a drop in hospital-acquired infection or decrease in mortality after the hand washing has been implemented, then they would be more motivated to continue their efforts.
Yeah, it's important to keep the program in a sustainable way to do it. Thank you. So Neil, what is your thoughts?
I come at it from a communication standpoint, and I mean, hospitals, I don't work in the industry, but I know they're so important and so busy. And I keep thinking of the word triage all the time, and what the nursing and medical profession face daily in terms of challenge. But I don't know if people take enough time, like management take enough time to really explain to people the importance. Like everyone knows hand washing is important, obviously, and you go through training, but how about tying it back to the stats of Canada and specific to the healthcare region to say, okay, we crunched the numbers in our team, and there was 100 plus probable deaths that were related to this yearly, just in LHSC, right? And I think when you can personify, probably that's not the right word, you can make that a reality, that if we could save 100 lives, we'd probably take this a little more serious and work it into the program. But I still got to add, and it runs back to the point, because I work with lots of trades, like don't miss the opportunity here in motivation to work with the front line, to work with the people on the floor, to understand what could be done better, because that's where the rubber hits the road. And if management don't take those steps, they're missing out on the best opportunity in-house and internal. So.
Yeah, that's important. I can see your point, like how we make them know it personalized, that everybody get the message across. That's really very important. So how about, I think we get two more. Linda, please go ahead.
So anyone that works at VGH knows Angus. He's a C. diff dog, and this dog is specially trained to sniff out this specific type of infection. And so the dog will go around to different units with his handler, and if he, sniffs it out, it's kind of like a bomb dog, he'll sit down. And so every time Angus comes around, we're all a little nervous because we're like, oh my God, like, is he gonna identify this bacteria on our unit? And so I feel like that's been really effective. Like, I feel like whenever he does identify something, we'll get a report later saying these are the areas that need to be cleaned or whatever. After that, we're all really good about wiping it down more. So I would just say, like, information and data, it's such a good incentive. Like, I feel like after he comes, we are all so diligent, and then it kind of wanes, and then he comes again and we start again. So I think that's been a good one. And yeah.
That's a very creative way to putting a censorship in a softer way, I think. So Ruchika?
I would like to add on what Neil said, that people are aware of the importance of hand washing, but I believe still communication and effective communication intermittently would definitely probably increase the compliance rate of the hand washing.
Yeah, thank you, Ruchika. So we go to the next question.
Okay, here's the next question. Which communication channels would you use to improve the compliance? So you have to type your answer within 20 characters. So you can think of what type of communication is required for engaging all stakeholders in hand hygiene compliance, like merchandise or posters, whatever you think of. So you can please type here, and let's see what are the responses. So you still have 30 seconds to think. We have also got some answers here. And if somebody wants to speak for their answer, please raise your hand so we can talk on that. So there are communication is very important part for a successful hand hygiene program. So as per you, what is the best way to spread awareness on hand hygiene through communication? So now time is over, and here we are having a few answers. So Jordan, please, what is your opinion?
So I was actually just thinking about something we've integrated in the past to look at where we're lacking funding or where we need more roles. We carry around Palm Pilots that vibrate every 15 minutes in your pocket with the reminder to input what you're doing. So that's one of the ways that the hospital looks at kind of where we're losing staff time or where nurses are putting their time. I think something like that, where someone was mentioning their iPhone would flag them, would be helpful as like a habit building practice. as a way of communicating that amongst each other. Because if your phone does vibrate, or if you have an Apple Watch or something, that could be a useful tool to disseminate when to wash your hands. And then if that could kind of formulate some information the way the Blackberries do about who's been compliant and who hasn't, not associated with your name, but like kind of like a Peloton board, a motivational board.
Okay. Good idea you are given. Neil, do you want to add something? Okay, so
sorry, Vinod, I have my hand up. Or I never
okay,
took
so
my
we
hand
are
up.
moving to the next question.
Which leadership style will be the most appropriate to get results? I will keep this question short because the other team already talked about this. But when answering this question, please think about the environment. We are talking about a hospital, healthcare issues. So when making your choice, please focus on the environment, please. We still have some seconds to go. Okay, let's see the answers. Most of us selected coaching. Would anyone that selected democratic talk about it? Or anyone would like to speak about their choices? Or even if someone would like to talk about what Florence presented in regards to expert leadership versus shared leadership, it will be fine. Okay, I think we have talked a lot about this, so we'll skip this question and keep going. Thank you very much.
Hi, so next question will be a poll question and multi-select. Regarding the fixed budget, which issue leading to non-compliance would you tackle first? Is that setting up engaging propaganda, or installing compliance checking chips, or update hand washing facilities, or improve communication? Well, please specify how to improve. You can choose more than one answers. So the manager of infection and prevention control had been clear to Noble that LHSC was on a fixed budget, and any new initiative would need to be cost effective and well justified. With this thoughts in mind, which issue leading to non-compliance would you tackle first? Or just a little bit brainstorm. It doesn't mean that we cannot use method that is expensive. If you think it is really important and it is going to help, we can cut the budget and then from other parts apply to these methods. But you need to have a strong reason for that. If you have any other answers related, you can also raise your hands and share your idea. Good. So looks like more people are choosing upgrading facilities for hand washing. Is there anyone want to share the idea of why you choose this answer? Or if you have any other ideas of other suggestions for improving that? Yeah, Shalisa, go ahead.
I think the reason why I say it is because, like, when I was a student, I remember working at Burnaby General Hospital, and there was no sink outside like when you were leaving the room. You had to go to the nursing station and wash your hands. So that's a huge barrier, and it actually is not part of your 4 points of contact to walk all the way to the nursing station to wash your hands. So I think that's just one example.
Oh, I'm surprised there's no sink out of the room. But yeah, thank you for that. Terrence, you want to share your idea?
Yeah, so when I was reading the case last night, I read about the compliance chip, and like at first it sounded like not a good idea because no one likes being policed. And then I think Linda brought up the Angus the dog, and like when I think about it, that's like a form of policing, but they weren't like opposed to it. It was welcome. So I can't really think of why. Like initially, policing sounds like a bad idea, but it seems like it could be a good idea if done in the right context. But yeah, that was just my thoughts about it.
Good. Yeah, so that's why we listen to different ideas, and sometimes they will probably affect how you think too. So Tsubasa, do you want to share your idea?
Yeah, I also picked upgrading facilities for hand washing and kind of answering Tobias's question here in the chat saying maybe fixed budget is the problem. Definitely the fixed budget is the problem. I think with budget allocations, money tends to be spent on high profile projects. Some of the more mundane projects don't get a whole lot of attention, and upgrading sinks or adding sinks and hand washing stations throughout a hospital doesn't exactly sound like the type of project that gets a lot of additional funding in the future, even though it is probably the single most effective way to reduce infection. I think as administrators, there needs to be a more tactical approach to funding allocation, because definitely, I'm a designer, so physical barriers to compliance is like the first step of solving a problem. So if it's easier for people to wash their hands, then naturally you get more hand washing occurring, period. And that's a really easy thing. Like infrastructure is a very easy thing in my mind, easy approach to solve a problem like this, at least as the first stage. I know this is a multifaceted problem, but number one, get the infrastructure where it needs to be to make it as easy as possible for people to comply.
Okay,
Yeah, as you said.
I'm gonna go ahead and interrupt and jump in because we're just a little bit over the 45 minutes. Thank you so much, Team 10, for your presentation. Nice use of some creative approaches, both to the Q&A session as well as the presentation. I want to point out something regarding, everyone loved the very creative style of using interviews to present the information about the case and the specific situations for 4 different groups. I also want to highlight, not only was that a great way to present the information, but just as a leadership behavior, it's really, really important to consider that if you're trying to make a change like this, one of the first things you probably ought to do is actually go out and interview and talk to those groups of people. And especially, you notice today in our conversations, a lot of people who are working in the healthcare area, they've got tons of ideas and thoughts and opinions and perspectives on this. And so if you're in a leadership role and you're trying to do something like this, in my opinion, step one is get out there and have those conversations and get that feedback and do those interviews and learn and understand what people are thinking and why they're thinking that way. So great way to present, and also a good reminder of an important leadership tool. Okay. Thank you for all of your great presentations. This has been really, really good to see all these presentations. One thing I want to point out about all this is, so the last thing you need to do today is provide your feedback to Team 10 and then do your reflection for the day, right? And the last thing I want to point out about this format we've had of different teams presenting, I hope that you've gotten a chance to get to know your classmates even better than we did in our first 5 sessions. One of the biggest assets that I gained from my MBA, which more than 10 years ago I studied at the University of Texas at Austin, it was the relationships with my classmates and what I learned from my classmates more than the material, I think, that I gained from that. And I still keep in touch with and learn from those classmates even these 10 plus years later. So I hope that what we've done here, and you've had some nice inside jokes have been created about pizza and wishy-washy and probably some others. So hopefully you've kind of begun to develop a bit of an identity as a group, and that these connections that it's been a short period of time so far, but they'll continue to be something that you value for many, many years after the program. So wonderful, wonderful interaction. Appreciate everyone's hard work on this. Okay, so yeah, make sure you do those 2 things: feedback for Team 10, and then also your reflections for the day. And so I'll take any questions you might have. Vinod, got a question?
It's not question. Thank you for the format of your teaching. Actually, it was very entertaining and learning was very good in this manner. Whatever this assignments we have done and this presentation, so it helped a lot, and we will miss this thing basically.
Yeah, this has been great. This has been a lot of fun. Everyone's contribution has been fantastic. I've learned a lot here and hearing from everybody and getting different perspectives and ideas. So yeah, this has been a great format, despite the fact that we're doing it over Zoom, although there are certain benefits we're getting from that. So it's been good. Tobias, you have a question?
No, I'd like to give some feedback actually on the origin of wishy-washy, because I was kind of surprised actually that in North American room you also use that. So my background is German, and we use that word as well. And wishy, so to wischen, means to clean a surface. And if you do it in a washy, it's kind of like not a proper way. So you clean a surface, but not properly. So it's kind of like just, I don't know the English term for it, but that's what the word meaning is about. So it's great to see that it's used here as well.
That's fantastic. That's great. That's great. And very applicable to today's topic of washing hands. Very good. Okay, so final steps for the class are, is it a week from Friday, right? A week from Friday, your final paper is due. I've got office hours today and tomorrow. I'm still doing office hours next week. So that'd be next Wednesday and Thursday. And then for those that are interested, we will meet same way over Zoom on Monday at 10 a.m. And be sure and send me in the next couple of days, because I'll have to prepare a little bit, what it is that you'd really like to talk about on Monday in terms of a conclusion or capstone to what we've talked about. Okay. Totally optional. Totally optional. We'll keep it informal as well, so that we can continue to kind of interact in a way that allows lots of different comments and suggestions.